a lovely day, and I would want to say hello to each one of you that is watching the Ben Live. I so humbly welcome you, and I would just request you and encourage you to call more other people or text your friends, or you can give them just a call, or you can send them this link where you're watching us right about now, and then they can be able to be part of this interesting discussion that we yet to have here. It's the Ben Live, and I welcome you so much. The most important thing here besides watching, please make it a point to subscribe. But well, today it's an interesting one because in this very episode we yet to unveil something very amazing, and this is about oral care. Talking about oral care, it could be things to do with dental, or what we call the tooth, everything that is within your mouth. Yeah, that is oral care, and it's a practice of preventing all the diseases, all the conditions that would have affected the oral cavity. I think you can get me well there. But well, my name is Giftina Kainga, and I'm not alone right about now. I do have our dental surgeon, and is
my name is Dr. Edmond Miomba. I'm a dental surgeon, and I work with the dental spa. Well, like she said, I encourage you to brush your teeth, call all your friends to come and watch the show, and let's enjoy the session.
What time it is that you're watching this episode, please, have you cleaned your tooth well? But well, do you even know how to clean a tooth? Or you just wake up in the morning and what you do, get a toothbrush, run to the bathroom, and then chop, chop, chop. In 1 minute, like you're done. But also we had a thought of, most of us, we've thought of oral care just being limited to in 1 or 2 areas. That is tooth extraction, or even root canal. That's if you even know root canal. And every time someone has a dental issue, they will be like, I think I need to go to the hospital, and they remove that tooth. Or I think I need to go to the hospital, and then they do a root canal. And well, to start with, we would want to, for someone that doesn't really know what oral care is and the importances of oral care, and would also want to look at some of those predisposing factors or things that put us at a risk of infecting oral cavity. So I'll go to Dr. Edmond to take us through, first and foremost, what is oral care. Then from there, of course, everything has an importance or a benefit. We would want to know the benefits, Doctor.
Yes, so oral care is generally it's like the health of the teeth, the health of the teeth and the mouth in general, the tongue, the cheeks, the teeth, the gums. What you do to keep the structures in the mouth healthy.
Talking of structures, which other structures?
Yes, structures. We have teeth, we have gums, we have the tongue, we have the cheeks, and the lips.
So of what importance could it be for me to have my oral care intact?
Well, oral care is the mirror for general health. When you have poor health inside you, you have so many other diseases. Usually, you find that you won't take care of your teeth so much. Let's say if you have whatever other diseases you might have inside you, you don't have the motivation to brush your teeth, or you're too sick to take care of your teeth, or you have so many other issues, you have too much stress to think of going to a dentist to have that tooth filled. You see, now when you have poor oral hygiene and a very dirty mouth, it usually indicates that you're having so many other issues inside you. You see, yeah, because the mouth is a very intimate place. It's a very intimate place. So if you don't take care of it, you're probably not taking care of so many other things inside you. That's why it's important to have excellent oral health. And also, oral health is kind of a measure. It's kind of a measure of someone's lifestyle. It just shows you how someone cares for themselves. Yeah. That's why it's good to have great oral care.
We are at dental spa, well, and for them they will tell you that smile in comfort, smile in comfort. Some of us, we don't want to smile, yeah, make and smile. So we don't want to smile because we'll be like, we're not sure what is inside there or what would come out of our mouth. But well, it's okay for you to smile, and then dental spa is telling you that smile in your comfort. And we are right about now, yes, that is Makere Kavule. You can come through its level 1 and then come and visit dental spa for them to make your smile be out in comfort. Yes, going ahead with Dr. Edmond, we want to still get to know, before we go into the special treatments, what are some of the causes? We have a lot of things that predispose us to bad oral care, yes? So we would want to get to know what would be those predisposing factors or the causes of the different conditions that happen to come up and affect our oral cavity.
Yes, the main thing which affects oral cavity is poor hygiene. That should be 98% of the things which cause. I'm just giving you a random figure, but it's a major thing which affects the oral cavity, because almost all the things that people come to the clinic for are related to decay, are related to dirt in the mouth, are related to cavities in the mouth, broken teeth and everything. Now, all of these can be avoided when you keep your mouth clean. Yeah, you see, cavities or dental decay stems from food which sticks on your teeth for a long time, giving chance to bacteria to start eating away the food, turning it into acid, which burns into the hard part of the tooth called enamel. So if you don't give chance to this bacteria to chew the food sticking on your teeth for a long time, then the chances of you getting cavities or getting poor oral health are very, very low.
Can you take us through of some of the techniques that maybe someone would say, I think I've not been doing that right, yeah?
The first one is brushing. Brushing, we recommend that you at least brush every after meal.
Yes. Every after a meal.
Yes, it's recommended, yeah, to do that. Sometimes it may not be possible, but at least brush your teeth before you sleep, because that's a time before you sleep. That's a time when the bacteria is most active on your teeth. Yeah, that's one. The other one is flossing in between the teeth, because the toothbrush can't go very well between teeth. So flossing is a piece of string you pass between the teeth. That's a good one. The other one is eating healthy. Yes, eating healthy. Eating healthy. The diseases we have in our generation are mostly lifestyle diseases. Yeah, diabetes, HIV, dental decay, all those ones are lifestyle diseases. And the lifestyle diseases, hypertension, they're usually related to poor diet.
Please make it a daily thing, to once in a while, I don't know how often, or once in a month, that you come out and be like, let me go to dental spa in Makere Kavule, such that I'll turn on that checkup that is really required. They can trace all the things that you cannot trace while brushing, they can trace them well, and it could be of good help to you in future, yeah? Reducing all the expenses, because I wouldn't say the procedures are expensive, you will tell us. So, well, besides those factors, we would want to go into prevention, yeah, or even management. There are people out there that are already sick, yeah, their teeth are not in good shape, yeah, but they don't know what to do. They do not know what to do. Though some of us are like, me, I'm okay, I'm not yet, my teeth are fine. But there are some that are not in good shape. So we want doctor to tell us through what treatment is out there. If someone has an issue with their oral cavity, we would want to know the whole sum of the treatment that is out there, because we just know tooth extraction, root canal, but I think there is so much. So we want to dig deep into that, such that we open your eyes unto the different treatments that are out there for your oral cavity. I welcome you, Dr. Edmond, once again.
So the different treatments which are provided in almost every dental clinic, especially here, we have the commonest is tooth extraction. We call it oral surgery. It's tooth extraction. Oral surgery has so many other branches in it, but the most common is tooth extraction, and it as well. It has different categories of tooth extraction. Yeah. The other common one, as we all know, is root canal treatment, which we in Uganda we refer to as okutta emiswa. Yes, it's a common phrase used. Yeah, it's basically just removing the nerves of the tooth and re-cementing it back and keeping it there. The other common one is crowns and bridges. Crowns and bridges. When a tooth is very damaged and we want to restore it, to put it back into its original shape and keep it there for a long time. Yeah, it's called a crown. You trim on top of the tooth and put a cap, a jacket crown, a jacket cap on top of the tooth. That keeps it for a much longer time. Yeah. The other common treatment we have is scaling and polish. Scaling and polish is commonly known as cleaning of our mucosa manyo. That is the basic removal of plaque and tartar from your teeth. We have another one called implants, the tooth replacements, artificial tooth replacements. We have the dentures. The dentures are the artificial teeth which you can remove and put back. Yeah. Then we have the implants. Those ones are fixed directly into the bone and they are not removable. Dental implants. Then we have the braces for poorly aligned teeth. Yeah, if you have crowded teeth, you have malaligned teeth. Basically, we have the braces which can put your teeth back to normal. And then we have treatments for discolored teeth. We have the veneers, which are basically like a layer of artificial tooth you put on top of a tooth, which is discolored. We have teeth whitening procedures, which are bleaching, can turn your teeth from yellow to a certain whiter shade, or even a very good white shade. Then the other one, which is really common, are the fillings. Yes, we call them the dental cements or dental fillings. So many different types of fillings: amalgams, glass ionomer. We have 3D fillings. We have composites. So many types of fillings. Yeah, this is also a very common treatment.
We still are on Hope Dental Spa, and it's located around Makere Kavule. The building is called Shanana Plaza. Yes, the first floor. You can come through and get the best oral care if you can't do it from home. Just pass by. Doctors told us, just come and visit even when you've not come for treatment. Come through and do a visit, and then you're watching the Ben Live. Kindly make it a point to subscribe. Please subscribe, share on your WhatsApp, on your Facebook, whatever platform you're on. Just copy the link and share with a number of your colleagues or your friends. Let me go to Dr. Edmond to take us through what is entitled in these different treatments is mentioned about who's eligible for the treatment.
Right. So now the most important thing, there is no formula to who should get certain kind of treatment.
There is no.
Yeah, there is no formula that it's only a 29-and-a-half-year-old who must get braces. No. It is when you have an issue. Okay, even before you have an issue, you need to have those checkups done. When you have a checkup, your dentist will tell you what issues you have and what recommended treatment you must get. Yeah, that is That is it. There is no formula.
So that is it. Everyone is eligible depending
On what the
what
dentist
code
finds. Yeah.
He's still watching the vein live and still about oral hygiene. Hygiene is really very key and important. Yeah. He mentioned that two main things is oral hygiene, and then another thing is the dental visits. Yeah. But well, oral hygiene is done from home before you even proceed for dental visits. So talking about oral hygiene, we've heard about so many products on market. There are so many products that are on market. I wouldn't mention some of them, but they're out there, many of them. And someone can tell you know what, use this particular toothpaste, use this and that, do this, get hydrogen peroxide, just use it for brushing. You can use the salt for brushing. You can use charcoal for brushing. So I would want to go to our Dr. Edmond, to take us through all the products, how best, yeah, can we use them, the quantities, are some of them even effective, or we just do what is not even necessary?
Yes, they all have their uses, and you can't say that, you can't tell someone don't use salt, because we always recommend salt in the clinic when you have wounds, when you have swollen gums. You see, we recommend you to use warm salty water to rinse. You can't say don't use charcoal, because there's certain toothpaste. I need to be sure, but certain toothpaste is called charcoal toothpaste, I think, and it's used. Yeah, so charcoal is also fine. Hydrogen peroxide, we recommend it when you have wounds and swollen gums and everything. Yeah, so it can also be used. The other one and all those other products, they are all fine. All you have to do is to be sure that what you're using it for is what to use it for. Let me give you a very small example. Yes, you might have a cavity, a very big cavity, and you decide to use salty water to treat that cavity. It won't work. It won't work. You need to be sure what you're using, whatever product you're using for, that it's the right thing you're doing.
Okay, and that's about the different products, and we're still about oral care. Doctor has told us about using, you can use a toothbrush, you can use dental floss, but well, there are so many toothbrushes on market. Can you just help us of if someone walks into a shop or a supermarket and they would want to procure one, which particular toothbrush they should look out for?
For a child, you just get a toothbrush with soft bristles. Yeah.
Soft bristles?
Yes, a soft toothbrush for a child. Or if you have so much sensitivity on your teeth, a soft bristle toothbrush will work. Yeah. But the comfort for the general population, the common toothbrush is to get a nice hard bristled toothbrush. Yeah. A nice hard bristled toothbrush, which you replace, recommended, every 3 months.
Every 3 months? Okay.
Yeah.
So you get a nice
hard bristled
toothbrush.
Yes.
And you have to replace it?
You don't have to. You're recommended to.
You recommended to?
Yes.
So if someone happens not to really, every after 3 months not to change?
Well, if I brush once a week, I'm probably not going to overuse my toothbrush. So after 3 months, it might still be new. Yeah, but after 3 months, it's assumed and expected that if you brush 3 times a day, that your toothbrush has surely weakened and the bristles are soft. Yeah, it's just really a sample time.
Thank you so much, Doctor. And that is oral care. He mentioned about the things that really predispose us to dental problems or the different dental conditions. And one of the things he mentioned about is poor dieting. Yeah, is it poor dieting? Yeah. Not eating healthy. Yeah, it's maybe like poor dieting. But then we're going to go into details of him, just helping us to break through that poor eating, not eating healthy. What are those things that are not healthy? Because we would really want to get to know from even childhood, what are those things that are not recommended for children maybe to be eating?
Well, again, gift, it would be better if a nutritionist gave you that information. Yeah, but generally, uh, the sugars, yeah, yes, the sugars and those fatty oils are usually from general knowledge that we know that when you have excess excess carbs, yeah, in your diet, you're going to have so much sugars and everything, and these sugars are the key factor in dental decay. Yeah, these sugars. If you can think of sugary foods, that's over-the-counter snacks, those crisps and those biscuits, those sweets, those chocolates. Yeah, yeah.
Ice cream.
Yes. Well, yeah. So it is just it's just the sugars. Yeah, which are bad for our teeth.
Okay, so I think that is well mentioned, the sugars. If you've been a person that has a sweet tooth, please, you can just try to regulate, or even besides, you can immediately after taking those sugars, brush immediately, yeah. We've also had people, as we try to wind up, we have people who have, doctors mentioned of the different conditions that are come up due to our different lifestyles. We've had people who have diabetes, and it so happens that they will tell you, if you really have diabetes, don't just go in for a tooth extraction. If you have diabetes, if you get any wound in your mouth, do ABCD. And I would want to get it from a professional doctor to tell us if someone is out there and they have diabetes mellitus or high blood sugars, if they happen to get any issues or challenges with their oral cavity, what are the steps for them? What are they supposed to do?
All right. Yes. So we have so many other things which people mention besides diabetes and hypertension. We have pregnancy as well. I recently wrote an article on dental treatment in pregnancy in the papers. We have other diseases, sickle cells and the cancers that don't get dental treatment when you have these. Yes. Now, dental surgeons are trained to make sure they handle you in the right way when you have these conditions.
Yeah.
Yes. Yeah. Every dental surgeon is trained to know what to do when a patient walks in with high blood pressure. Yes. Because if you have diabetes, you can't spend the next 20 years with a painful tooth. You can't. You see, you have to go to the dentist and they handle it appropriately. Yeah. So every treatment, every condition has a way in which it can be handled by a dental surgeon. Yeah.
Okay, thank you so much, Doctor. He mentions a very good point that every condition has its best way to be handled, and that way can be from a professional or from a specialist. Yes, is it about your teeth? Please come through, and just our time is running so fast. I'm just going to be requesting our dental surgeon, Dr. Edmond, to just give us a wrap-up of what is expected of us if it comes to dental care or oral care, and what is expected of them, and it's going to tell us of where to find him and also get his contacts just in case we want to visit our dentist for your oral care.
Okay. Yes. So in conclusion, the two most important things in our health are to take care of it, because it's priceless. Health is wealth. Take care of your health, take care of your teeth, brush regularly, visit the dentist and the general doctor as well for checkups regularly. And then the other thing which is important for me to mention before I leave is to educate the masses about all these different dental treatments. There's so many dental treatments, as mentioned earlier in this video. Very many different dental treatments. Yeah, research about them, get to know them. Don't always try to remove your tooth for every procedure. Yeah, for every issue you have. And lastly, I'm a dental surgeon, Dr. Edmond Muyomba. The dental spa. The building is called Shushan. Yes, Shushan Plaza, first floor. The dental spa is on social media as well as Dental Spa Kampala. The only Twitter, Facebook, and Instagram.
Dental Spa on Twitter,
Dental Spa Kampala on Facebook, Dental Spa Kampala on Instagram, Dental Spa Kla on Twitter. Our office line is 0200 Yes, when you call, the receptionist will be able to pick you and direct you to this place.
And well, to our beautiful viewers, I know you are a very nice audience. You make it a point to always be here and check out the content that we really have for you. I want to thank Dr. Edmond so much for the information he's given to us. It's very helpful, and you need to just pass it on to other people. That is sharing this video to everyone. Any clip that you find that is about dental, please share it, and you also make it a point to come through on Dental Spa that is on Shoshana Plaza, Makere Kavule, level 1. The numbers are 0200991188, or you can also reach them out to 0778299685. Book for an appointment. Doctor is here every single day. Let's mind our oral health, because techinyuma kwogera n'abantu nga akamwako tekavaamu birungi. I mean, not the ones you talk, but even if you're talking good words, if akaswaka kuvaamu si kalungi timalamu amaanyi. So let us be in position to frequent those visits. I mean, that dental visits, just like you walk in another hospital and check your blood pressure, your what. Let it be the same thing with your dental care. Come through for the different dental visits. Well, Gift Nakayinga, and you've been watching the Ben Live. Please make it a point to always stay here. If you've been new and it's your first time to be here, please, it's just becoming your home every single time. Come and take us through what we do have for you, and we'll be in position to grow together with you and have a healthier and better life. So till next time, bye.